y traer un barco de otro país aquí, ¿por qué no lo llevaste de donde estaba? ¿Por qué lo tienes que venir a traer aquí a Canarias?
Pero bueno, también hay que tener algo de empatía. Son personas que necesitan igualmente ayuda y estamos como que en el punto medio igual. Pero es verdad que si pudiesen aportar mayor seguridad y demás, pues estaría muchísimo mejor.
The outbreak on board was first reported to the World Health Organization on May 2nd. The WHO says 8 people have fallen ill and 3 have died. More than 140 people are still on board. According to the World Health Organization, none of them are experiencing symptoms of the virus. The WHO making it very clear the risk to public health is very low. They explain how the disembarkation process will go.
So there will be small boats that will bring the passengers in groups to the dock. There will be a medical screening that will be done. If there's anybody that develops symptoms, anybody that has symptoms, they will immediately go to a medical evacuation plane and be taken to the Netherlands for care. For those who are healthy, those who are doing well, they will go to individual planes that are being organized by countries.
Some port workers and residents of Tenerife have protested the ship's arrival. The World Health Organization's Director General is there to reassure people that they are in fact safe.
This disease is not COVID, and we have said it many times as WHO. And when we say this, we don't take it lightly. And then, of course, the other issue I'd like to say, which I also indicated in my message to the people of Tenerife, is the risk to the population, to the local population, is low.
CNN's Melissa Bell has more details from Tenerife.
It is expected now that the cruise ship will arrive here just off the southern tip of Tenerife in the very early hours of Sunday morning. The head of the World Health Organization, Dr. Tedros, will be here in person to oversee this operation with the Spanish Interior Minister, the Spanish Health Minister. And what we've been hearing from Spanish health authorities is that there will be no risk of any contact with anyone here on the island of Tenerife. In fact, what they say is that the passengers getting off this cruise ship and taken onwards to their flights and onto the quarantines that are being put in place by their own countries, the only people they're going to be in contact with here on the island of Tenerife are either medical personnel or personnel from the Spanish military, all of them wearing these special masks that you'll remember from COVID times in order to protect them. Now, there's also been this very unusual and very personal message that's been sent from the head of the World Health Organization to the inhabitants directly of Tenerife, thanking them for this gesture of solidarity and really explaining that it isn't simply that Tenerife had the medical facilities and the personnel needed to oversee and to allow to facilitate this very complex operation here on Sunday, but also that they'd had the humanity to do so. This had been, for the people on board, he reminded everyone, such an ordeal, not simply because they were stuck on the boat with such great uncertainty for so long. Some of them are grieving, he points out. Some of them have, most of them have feared for their lives. And so it is a gesture of solidarity, of humanity, explaining in that message that the greatest immunity from outbreaks like these is solidarity and humanity. So he himself now overseeing that operation, and it looks as though this Sunday, after all of these weeks of uncertainty, should see the end to this particular stage of this ordeal for the passengers of the ship. Then begins this complicated logistical operation, and for each of them back in their home countries, a long period of quarantine and another step in what will be a difficult operation to keep them and the populations around them safe. Melissa Bell, CNN, Tenerife.
Well, health experts do agree that a large-scale hantavirus epidemic is unlikely. But in this post-COVID era, public concern does remain high. CNN's chief medical correspondent, Dr. Sanjay Gupta, explains why the risk of widespread transmission remains low.
I think there's three primary reasons why people are not that concerned right now from a scientific perspective. One is something known as the reproductive number, which basically is saying if somebody has it, how many people are they likely to spread it to? And that number is 1.19. To give you context, during COVID at the height, the number was somewhere between 2 and 4. So, significantly higher, doubled higher. Small window of spread. With COVID, people could spread the virus even if they weren't sick. With this, it seems to be a very narrow window through which they can spread it when they are sick, and that usually lasts in terms of the spreading time frame a couple of days. And finally, if you look at the genome of this virus, going back to 1996, really is not that different than today, 30 years later. COVID was mutating all the time. You remember all those variants? In 30 years, this hasn't mutated that much. That could change, again, as more people get it. But so far, I think these are the three reasons people are not that worried.
Now, as we mentioned, the passengers will go straight from the ship to a special biocontainment aircraft. For the American passengers, their flight will take them to the University of Nebraska Medical Center and to stay at the country's only federally funded quarantine facility. There, they'll undergo evaluation and receive any necessary treatment. This same facility was the epicenter of the US's early response to the pandemic, treating some of the first Americans diagnosed with COVID. Joining me now is Dr. Deli Davies, the Interim Chancellor of the University of Nebraska Medical Center. Thank you for being with me, sir. I appreciate it. Let's talk about what we'll be seeing very soon. What exactly will happen when these passengers arrive in Nebraska, and what will the monitoring and evaluation process look like from that point?
So we're expecting these passengers to arrive sometime early Monday, and they will be received by us and our federal partners. We have partners from the CDC and other agencies who will be here. And we will be here ready to support them in any way, shape or form. We have, as you pointed out, a unit that is designed to keep patients, people like these who have been exposed to potentially deadly diseases. And we have facilities that are specifically designed to keep diseases out of the public. So basically we have individual rooms that have negative air pressure. We have the air is filtered before it goes out. However, these rooms also have ensuite bathroom facilities and have exercise equipment and Wi-Fi, so that if people were to stay there, they could have a relatively normal life. And we have a lot of highly skilled nurses, physicians, and allied health professionals who are standing by ready to work with our federal partners as needed.
How prepared were your team for this situation? Because it sounds like you were very, very prepared and everything was pretty much set up.
Yes, so we have had we've had expertise in this area since 2004 when we opened the biocontainment unit here. And we were drilling for several years before we got the first patients with Ebola in 2014. And then, of course, we had patients who came here for COVID in 2020. And so we are ready. We have, interdisciplinary team of people who work together regularly and drill together quarterly and make sure that we have all the skills and exercises and drills to get us ready for such a time like this.
What are the doctors and infectious disease specialists specifically watching for in passengers who may have been exposed to this hantavirus?
So we expect that most of them will be well. That's what we understand. But, the symptoms that usually we're concerned about will be, things like headaches, muscle ache, fever, stomach ache, nausea, and vomiting. And if the disease progresses, then they can actually start having difficulty breathing, coughing, with fluid accumulating in the lungs. And in the worst case scenario, their blood pressure may go down and they may need help to support their blood pressure.
If someone does test positive for this, what treatments and supportive care are currently available? And how important is early detection here?
Early detection is important because, one thing we've learned from previous reports is, first of all, it could take up to 42 days for people to develop symptoms. Wow. But when they do, at the time that they have the high fever is when they're more likely to spread it. And, of course, the symptoms can then evolve fairly quickly after that. So early detection is important, and we, obviously we here have the ability to monitor that. And I know that our federal partners, if the passengers were to be transferred elsewhere, are also taking that into consideration.
What would you say to people watching all of this unfold who may now be feeling anxious or scared about the risk to them and to the wider public?
I would say that the risk is very low. Clearly, these are passengers who are right now healthy. In terms of the general public, unless they happen to be, amongst people who have symptoms, who clearly have the disease and they are in close contact with. So somebody who has a high fever who was on the boat, or maybe has any of the symptoms I described earlier, if you happen to be in close contact with them, then there is a risk. But generally, for the general public, it's highly unlikely that they have anything to be concerned about.
播报新闻是我的日常，必须时刻保持妆容和皮肤的最佳状态。当来到人生中最重要的时刻，也是 KS 逆时奇迹帮助我轻松驾驭，闪闪发光。KS 逆时奇迹活肤露全效精华、精华霜，多达5种 EGF 6大冻龄关键成分，保湿效果让我非常满意，小细纹也不再困扰我。我就是我自己的最佳女主角 ，KS 让我从容自信，光彩动人。我是我人生中的大女主，我的最爱我做主。KS 逆时奇迹系列热卖中，下单请上快点购，透过中天新闻网 App 下单立减50，或输入 CTI 推荐码有额外折扣。